and I joined BMJ in February this year because they launched a new tool called Impact Analytics. And prior to that, I used to work at a company called Digital Science, and I used to work specifically on two products. I used to work on dimensions, and I used to work on altmetric. So the last few years, what I have been doing is specifically working with universities, funded organisations who want to look at the impact of their research and analyse the impact of their research. And one of the things that people used to talk to me about all of the time was policy citations. Looking at understanding their impact outside of scholarly and academic metrics, right? There's another session on that tomorrow if you'd like to come, but I don't want to speak too much about it. But people, the funder mandates are changing, right? People they want to be able to demonstrate the impact that you've had outside of maybe just publishing in an impact factor journal, right? And I think universities are now being pushed to try and understand how they're going to do that, because it's quite fragmented. The data is quite fragmented. So when BMJ approached me, I said to them, Elsevier, Clarivate, Digital Science, they've already got these kind of products. What is it that you could bring that would be special? And they said that they did a research study with their community to understand their biggest challenges. And they spoke to funders, they spoke to their universities, they spoke to researchers, they spoke to their publishers, they spoke to anybody that uses research, creates research, funds research, publishes research. They said, well, for us, really, the impact is the patient. You and me, when you go to the doctor and, you've got something wrong with you, the way that doctor is going to treat you is dependent on the types of guidelines that they're using. It's dependent on the research that you're doing. We saw all of that during COVID, right? We saw how quickly research and policies were changing, and they were affecting. One day you wear a mask, then you don't wear a mask, then you're 6 feet, and then there's only 6 people in a room, and all of that. But we saw that people were making decisions when they're building these health infrastructures and things like that very quickly, and a lot of that was done on preprints as well. So they said, well, actually for us, impact it's not just about impact factor journals, it's actually looking at policy sources and understanding at the point of care when a person goes to the doctor and seeing how seeing how my research is impacted there. So they basically listened to their audience, and they went away and created a tool. And today we have this tool called BMJ Impact Analytics, which is the most comprehensive tool on the market that enables you to track and share the real-world impact of your medical research. So even though it says BMJ, we're not just looking at BMJ journals, right? We're looking at all research outputs, and then we look at where those research outputs have been cited in global health policy sources, in global clinical guidelines, and the BMJ point of care tool called BMJ Best Practice. So that is a tool that is used by doctors on the ground when they're treating patients, right? So for example, scarlet fever or whatever, you'll be able to see that in that BMJ Best Practice, the treatment plan accordingly will cite research as well. So we created this tool that enabled you to do that. So it's a UI-based tool, user interface online tool that tracks and shows those unique outpoints. So in this tool, we're looking at over 30,000 global organisations from over 1,400 health-related sources from all the countries in the world, probably more than 175 countries. And there are more than 6 times more clinical guidance sources. I mean, this figure changes all of the time, and we're adding more and more clinical guidelines daily, weekly, as we all of the time. So for us, it's really trying to get closer to patient outcomes, see those clinical guidelines, where research is cited within those clinical guidelines, and so that we can help and understand not just where research is cited at the tier 1 stage of it, so we're not just looking at one policy source, but actually analysing the downstream effect of research. So you will see, for example, There was a piece of research, it was cited maybe by the World Health Organization, and then the NICE guidelines in the UK also cited that source, and then maybe also it was cited by NHS Scotland or whatever, right? So you can see that entire downstream effect of research. And we use machine learning algorithms that read the full text of policy sources and clinical guidelines to enable us to pinpoint, because these policy documents, let's be real, like they're 300-400 pages long, some of them, and the only thing that they cure is insomnia. If you want to read that yourself, okay. So that's what we're here about. But this tool is not to be used in isolation. Like when you're looking at impact, there are lots of other tools in the market, so you should still be using those amazing tools like Dimensions, like Altmetric, the SciVal, Scopus, Web of Science, whatever it is. That's where you start your searches. You do your big searches there, and then you continue your research journey to drill down further and really pinpoint and see and analyze those citations. So we're not just looking and following persistent identifiers. We're going one step further to analyze that, and I'll show you in a moment when I demonstrate the product. But it's important for us to put this into context, right? Because usually everyone's really used to seeing really big numbers when we're looking at citations, academic citations. But actually, only about 5 to 6% of research gets cited in policy. Okay, it doesn't mean it doesn't mean that your work is good or not necessarily. And you don't need to worry about it. But it doesn't there's no discrepancy in the quality of your work, and potentially sometimes that's something that we do need to track as well. But it takes about 5 to 10 years to get cited in policy. It's not like just an academic citation. It takes a couple of years for you to do that. But we want to put those kind of things in policy. And I ran the numbers myself every time I did the numbers for Oxford, for Cambridge, for Stanford. I was like, oh, okay, it's 5 to 6%. Some universities, it's a bit more, like Baylor College of Medicine, 10% of their research is cited in policy. It's quite high. And quite a lot of that is in clinical guidance as well. But, I think for institutions where you're asked more and more about the publications that you're licensing, the open access agreements that you're working on, when you're working with your researchers as well and trying to help them, find collaborators or a key opinion leader, or you're trying to help them, also within your departments, try to analyze the impact of some of these publication licenses that you've got. It's important for us to have all the tools in our box to analyze the impact of how far they're going. Okay, and these are the kind of tools that enable us to do that. So how do we do that? Okay, so we go to a pool. We have a pool of resource that we pull for publications, and that's the biggest pool outside of Dimensions. Is called Open Analytics. It's called, right? So we take the publications from there, and then we use machine learning algorithms to read the full text of policy sources and clinical guidelines and BMJ best practice, and then we show you where research is citing. There's a layer of categorization that's also put in there, so you can search by concept area, you can search by sustainable development goal as well. And then we make it easy for you to be able to sign to see those citations. But we can also show you and pinpoint where within the document itself that it's been cited. So if it's on page 20 or page 13 or whatever it is, we can show you that influence. And you have the ability to analyze further and see, to which degree was that influence important for you, as well. So that's how we do that. And we take a very broad definition of what we look at as health. We look at it in the broadest sense, and we think about it as it impacts any health, the health and well-being of populations, right? So when we look at policy sources, that's what we're looking at as well. And policy sources are defined as documents written for or by policy makers. So you'll also have think tanks in there as well. So that's another really good thing for institutions. Quite a lot of them want to see, if they've been picked up in think tanks, then quite often those think tanks influence the policy as well. So you'll be able to see some of that early attention that you you might want to analyse, and that gets then influenced in a policy source as well. So what can I use this kind of data for? So I covered some of this, but you can analyse the impact at the point that people access healthcare, right? So we've got the clinical decision support tool. You can have a look and analyse the citations from there. We can look by funder. So as an institution, you'll be able to see, for example, these are the publications that were funded by the US Department of Health and Human Services, or the Medical Research Council, the Wellcome Trust, or the NIH, or wherever that it is. You can also execute keyword or concept-based searches and say, for example, I'm looking for a key opinion leader in the area of oncology and COVID, who is heavily, whose work is heavily cited in the NICE guidelines or whatever. You'll be able to look up things like that. You can help improve, you can use the data therefore then to improve your applications for your researchers by uncovering these citations in policy and guidelines. You can track the funding globally, so you can see where you're getting funding from lots of different places, and see where then your research is cited across the world in different policies as well. So if you wanted to see, for example, if your institution, which policy sources in Japan or in China or in the UK or in Spain or Italy or France, you can also have a look at that. And again, you can do some of the usual things as well, like run an analysis with your DOIs to see, okay, here are my institution's DOIs. I want to use actually the data that I have to run that kind of search. So we have an API that enables you to do that as well. So you can not just have to therefore rely on the machine learning algorithms to take those documents in, because author affiliations are great, but if you know what your own data outputs are, then research outputs are, then they're always much cleaner to have. And then again, you can do the normal things like evaluate the impact of your partnerships with publishers. You can track your transformative agreements. If you're working with publishers on a read to publish deal, for example, you might want to look at the impact of that as well. And again, see which are the most influential policy and clinical guidelines in any certain topic area as well. But again, this is the type of tool to be used together in a research ecosystem with other research data products as well, to understand the research life cycle in its entirety. So let's go and have a look at the product. Okay, so I'm going to do a live demo here. But you can, so some of the things that you can do is just go in and type in the name of the university if you want to do that. So if I want to do university, it would be great if I could spell university. I did go to university, but I can't spell it. So if you want to go in and put in the name of an institution, you can go in and do that. You can also search by DOI, so you can search up to 10,000 DOIs in here. So if you've done a really complicated search in quite a in quite a good resource like Scopus or Web of Science or Dimensions. Well, Dimensions is good because it does full text searching. So if you could put in a bunch of DOIs in here as well, or you can do ORCID identifiers or PubMed Central or PubMed IDs as well. You could go in and see if those research outputs were then cited in policy. But what I've done is I've run a few searches already to save a bit of time to get to some of the data as quick as possible. So here, what I've done now is just run a search on articles from authors at Yale University. So I'm just going to press on this and wait for the internet to catch up. Okay, good. So now what you can see here is a visualization. And the internet catches up. It's working beautifully down there. But in the meantime, I'll show you this. Okay. So can you see there's 27,738 articles that have been cited in policy. Okay. If we continue to go down, you can see, for example, this particular article, okay, was cited 727 times, and you can see all these different policy sources that it was cited in. So you have the society policy clinical guidelines. You also have national and regional clinical guidelines, as well as policy sources as well from national and international and local policy sources as well. So you've got anything here from Australasian College of Sports and Exercise Physicians, American Society, Association of Study of Liver Diseases, to the City of Albuquerque, the UK government, the state of Maryland, the NICE guidelines. So you can see this article has been cited, many, many times across different types of policy sources. What we could do is see more abstracts as well. So we can go in and have a look. And you see some of these are in a different language as well. So it's language agnostic. So if your policy sources have been picked up in German, French, Spanish, Italian, whatever it is, we'll still be able to pick them up and also pinpoint page. Yeah, so we're not just following persistent identifiers, we're going further because the machine learning algorithms are reading the full text of policy sources and trying to help you get through the data quicker and pinpoint where within the text that it's been cited. If you click on this, it will take you to the page that it's been cited on as well. But what we can do is also analyze these 727 policy sources and clinical guidelines. So just waiting for that. There we go. Can you see? And if I go into the data view now, it will show me a data visualization of where these kind of policy sources are getting picked up. I'm just going to zoom a little bit further. Sorry. Can you see? Okay, so this one, so 727 policy sources from one research article in 16 countries and 60 sources, right? So you can see the World Health Organization, the NICE guidelines, AHRQ, Canadian Agency of Drugs, the German guidelines, the World Bank, and more. There'll be more here. So if you want to go in and analyze what they are, they're here. So you can see Cancer Care Ontario, American Academy of Orthopedic Surgeons, IFO Institute, Medicare coverage, Federal Register. Lots and lots of society guidelines in here as well. The OECD, the Scottish Government. And then what we can do is analyse. The internet is very slow. It's not showing the graphics that I wanted to show you. Okay, let's go back here.
Manisha?
Yeah.
We have like about 5
minutes.
or so,
Yeah,
so.
okay. So, and then we can go in and analyse the cited research outputs again. So I'll go back to that one. And if we go down to the list view, oh, the internet's not catching up. Okay, so again, you can analyse here. Can you see that you can analyse by the key sources itself. You can analyse by the different grey literature. You can analyse which countries those articles are in. You can analyse also by publisher, by journal output, by authors, by PubMed mesh terms, by the country and policy topic area and subject area of that policy source as well. But I'm going to have to leave it there because the internet has failed me today. But if you want to come and find me, I'll be happy to do an actual personalised demo for you at the vendor showcase. But technology is not on my side right now. But if anyone's got any questions, then we've got a bit of time for that.
So we're at booth 72 downstairs if you want to take a look and speak with Manisha some more. But yeah, we have a couple of more minutes. Are there any questions? It's still thinking.
Yeah, I'm still thinking, yeah.
I have a question.
Yeah, sure, yeah, sure.
So how are you different from Forward?
Okay, so Overton are our collaborator. Okay, so we built this together with them. They are our collaborating partner. What's different to us is that we have 6 times more clinical guidelines than they do in there, and the direction of the product is going to go very specifically in the medical sector. Well, it's going to be geared specifically for the medical and health policy researchers. So, for example, there's going to be better categorization specifically for like cancer, things like that. We're going to have versioning for the guidelines. That's not something that are going to go into the versioning of the guidelines. There will be gradings on there as well. There will be more clinical guidelines to be added, more and more clinical guidelines. There will be hospital care pathways put in there as well. We're looking more at the regulatory frameworks as well. So our pharma customers are very interested in that, especially with the work they do with the FDA and the real world evidence teams. So that's the direction that the product is going in. It's only like 9 months old. So yeah, that's where we go with it.
And do you have an annual license?
Yes,
or
we do.
Yearly,
Yes.
I mean, multi-year?
Yeah.
or-
Yes, we can do multi-year, or we can also do annual licenses as well.
You offer a trial?
Yes, we do.
Okay.
Yeah, we offer trials as well.
Okay,
Yeah,
thank you.
no problem. The other thing I forgot to say here, like with the authors, is that here we can search by author, irrespective of their affiliation. So right now, because I pulled up Yale, it shows me that author while they're at Yale. But actually, you could search here, for example, if you want to search by Harlan and Holtz, it will show you all their affiliations as well. And then you can choose which ones are interesting for you based on, you know, the funder application that you're doing, you know, and that kind of thing. So there are lots of ways to slice and dice the data. I also mentioned the API as well for institutions. It comes as part of the package as well. So you're able, for those who want to do more sophisticated searching, or they want to put it into their BI tools, the API is a good option to use as well. Yeah, hi.
What do you find is the biggest use case from your current subscribers? How are they?
The funder applications.
Yeah. Okay.
Because, you know, universities want to generate more income for themselves.
Yeah.
And the funders are changing their mandates all of the time as well. And one of the biggest things that they need to show is societal impact as well. So together with the metrics and things like that, this will show you quite, you know, tangibly, you know, with evidence like where you're having that societal impact. And also the downstream effect of research. Like what I didn't do here, which I can do afterwards, is show you where these 727 citations were then cited again by other policy sources as well. So that number sometimes doubles or triples. So and that's really interesting, especially during COVID, you know, it really showed the downstream effect of research to be able to analyse that. Yeah. Any other questions? No?
I'm hearing excitement. I'm hearing they're going to come see you at the booth. That's
Yeah,
what-
I hope so. I hope so. Okay, good. I'm around still if you want to. I'll be here until Thursday afternoon, so you can come and catch me on my laptop.
We do have a session tomorrow also.
Oh yes, tomorrow's session, yes. That's a really good session. So we actually have a panel discussion that I'll be moderating, which is called Real
Beyond
World
the impact factor.
yeah, impact
more than
beyond
just
impact factors. Yeah, it's more than just numbers. So we have the library director of Memorial Sloan Kettering, we have a professor from British Columbia, and we have another researcher from the Department of Nursing at Florida International University as well, and they're going to be discussing impact beyond the impact factor. Okay?
Grand Ballroom number 2 tomorrow at 11:15.
Yeah.
So thank you all so much. Thank you for coming. Manisha will be here till Thursday. But if you did sign up for the raffle, give me your card, please.